I feel like you gave Carol an introduction about green infrastructure. So I'm going to ask her to just talk about that implementation, especially bringing it to scale.
So I'm going to start off with a confession. We picked green infrastructure partially because of timing, because we had a new incentive program. It was fairly new in our local vocabulary. We had it in the infrastructure design manual, but we also picked it because we didn't currently have green infrastructure in any adopted capital improvement plan. So we weren't competing with existing ways of identifying projects. And so we focused in on this knowing that we could tackle these hard questions without being threatening to existing promise commitments to the community. And I'll say commitments to the community, but basically the old way of prioritizing things. And so a big part of going through this process were, and as Laura pointed out, what are the people things? What are the environmental things? What are the health outcomes? What do we measure to weight and understand those to arrive at recommendations for where we should invest and how we should invest? And by doing this in an area where we were not setting ourselves up to, oh, we need to defund this project to do this project, we were doing it in a new area, we knew that we could have success. Well, in doing that, we then created the base work to hand off to the Equity and Resilience Task Force, who was looking at the bigger question of, are we investing our capital improvement plan in the right way citywide? So we did a lot of the background work to catapult this to that bigger question. But we managed to do it in a way that we could have these discussions, that we could have these recommendations, and I know we're running up on time, so I will say the greatest thing about doing this in partnership with the National League of Cities was the framework and the resources and the safe space to have these tough conversations. The ability, not just the people that we had locally in the room, but the resources that were brought through the National League of Cities to provide us data, to challenge us with questions, to help us dig in and come back to these specific questions of how do I measure for health outcomes in a way that I can weight investment. I mean, really, and it's not a simple answer. It's multiple factors. But if you look at how engineers historically do it, what's the condition of the pavement? How many cars drive on it? Well, when you ask those two questions, you automatically exclude every portion of the community that's not in a car, because we're waiting cars. And so it made us get through those questions to the more important questions of, if the street is flooding and the person doesn't have a car, how are they going to get to work? Are they going to wade through the street to get to the transit stop to get to work? Now, that's if they're going to work. Now, what if they're going to their cancer treatment or their dialysis treatment or all those other things? And that's what's impacting that health outcome. And so I'm not trained as an engineer to think that way, but by putting us all in a room, we all bring our strengths to the discussion to have that.
I'm going to say, you don't sound like an engineer, Carol. I think you're betraying their confidence, but that's important that you don't sound like an engineer, because we need more engineers to sound like you.